new Roseland Community Hospital is situated on Chicago's far south side. The area is 95% black.
In this area, we're the only safety net hospital that this community has. A lot of financial disparities for them, financial disparities for the hospital.
Tighten it up, tighten it up.
At the height of the COVID-19 pandemic, long lines formed around the block in order to access the hospital's testing facility.
200 joules, stand clear.
While the hospital's 10-bed intensive care unit was swamped with patients.
Roseland Community Hospital is the epicenter of healthcare in the far south side, and we've taken a large brunt of the pandemic.
Dr. Karam Khan is the hospital's chief medical officer. He says the hospital, that was already struggling with funding before the pandemic, is now recovering from the latest Omicron wave.
In the middle of January this year, we had hospital beds lined up in the hallways in our ED department, where our hospital was seeing close to about 100 patients a day through the ER.
As a more contagious strain, Omicron in turn dramatically impacted the hospital's staffing levels.
Omicron hit, and overnight the numbers of COVID cases in the hospital would double, like night after night after night, until basically half the hospital was positive. Our staff was hit hard. It affected our ability to take care of our patients.
This is the hospital's 10-bed intensive care unit. For the first time in over a week, there are no COVID-19 cases here, and the unit even now has some empty beds.
Be 10 minutes, it could be 15 minutes.
Data from the U.S. Centers for Disease Control show Black and Latino Americans suffer a death rate far above that of white Americans, nearly twice as high. And staff here say that more needs to be done to address the underlying issues.
The mortality rate is higher for COVID because not only the decreased lack of access to care for COVID, but I think it's more so because of their comorbidities. So if they're diabetic, hypertensive, they're not really as tightly treated as it would be if they're in a higher socioeconomic status, where again it comes down to lack of health care in the community, access to primary care.
The hospital has attempted to meet the various challenges posed by the pandemic to keep the community safe. But after 3 hugely impactful coronavirus waves, staff at the hospital remain guarded for the future. Dan Williams, CGTN, Chicago.